Alrighty, so I'm at the nurse's station, washing my hands, gathering my supplies, and I'm ready to go into my patient's room. So, knock, knock, knock. Hi, my name's Callie. I'm your student nurse. Is it okay if I come in? Perfect. I'm gonna provide some privacy. Before we get started, can I verify your name and your date of birth? Perfect, perfect. Everything matches. Do you have any allergies? Nope. Okay. Well, I'm just gonna wash my hands here. Write my name up here on the board. We're gonna put some gloves on, and we're gonna raise the bed up to proper working height for me, and then we're gonna raise the head of the bed up to about 30 to 90 degrees, because this is best when you are using an NG tube. All right, Maria, the doctor has ordered an NG tube, a nasogastric tube. Do you have any questions about this procedure? Sounds like the doctor explained it very well. But before we get started, I want to assess a few things. When was your last bowel movement, and how would you describe it? Okay. Are you feeling nauseated, or have you vomited recently? Okay, and I'm just going to go ahead and listen to some bowel sounds. These are in the left upper quadrant. These might be a little hypoactive because her stomach's not working properly. So, and have you had any history of nose surgeries or things like that? Okay, now I'm just going to take a look at your nostrils here. See if there's one that's bigger. We can close them, see if there's one that breathes easier. So we're gonna go and stick with the right nostril. Everything looks good here. So I'm going to lay out this blanket on your stomach, chest area. We've got this emesis basin here just in case you need it. Sometimes this can cause you to gag or throw up. That's totally fine. We've got this basin here for that. Now, at any time during this procedure, if this is making you gag or something, please feel free to raise your arm up and I'll be able to stop and we can reassess from where we're at, okay? So, let's go ahead and measure this tubing to make sure that we've got it as far down as possible or as necessary. So what we do here is we measure it from the tip of your nose to the tip of your earlobe and then down towards your xiphoid process. And for me, it's about 55 centimeters. So I'm just gonna go ahead and write this down or let my aide know or tape it, put a marker on it, whatever's necessary, but we know that that's 55 centimeters. So now I'm going to stick, we're gonna wrap this up, make sure that it's the right flexibility, things like that. Everything looks good. This can also help point the tip of my tubing. We're now going to stick this in a water-based lubricant so that'll help go through the nose easier. We'll just set that there pretending that it is in the water-based lubricant. Now I'm going to pull up 30 mils of air. Typically you would use a bigger syringe than this, but I don't have one, so I'm working with what I've got. Also, I believe that this device here is to help with suctioning. Natalie mentioned it, but you couldn't quite see what she was working with, but this works really well with my syringe, so I'm just gonna keep it. So I've got 30 mils of air. We're just gonna stick that there. Now, Maria, at any time, so I'm gonna have you tilt your head up a little bit once we start, and once I can feel that it's starting to go down in your throat, I want you to swallow this water a lot, and this will help us make sure that it's going in the right area. So I'll say swallow and just listen to my voice as we go through this and I'll help you through it all, okay? All right, so you'll start going up and then you'll tilt your head down. So I think we've got everything ready. All right, so let's tilt your head up now. And down and tilt down, chin to chest, swallow, 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 swallow. Swallow, keep swallowing, you're doing great, we're almost there. Perfect. Okay, we're at 55 centimeters. I remember this because that's where I marked it. Now I'm going to just put a simple tape right here and make sure that it's not going to move around. This tape doesn't do too well with my gloves, so perfect, sort of. Okay, we're just going to pretend that that is taped. Now before I do anything else, I want to assess the patient, make sure that they're doing well, they're not having trouble swallowing, that they're doing okay. So that looks good. I also now want to assess the placement before we make anything final. So you can do this one of three ways. You can do this by sending through the air and whooshing it. You can do it by x-ray, or you can do it by pulling out the stomach content. And I said one of three ways, but I actually meant two of three ways. So do two of those to make sure that it's proper placement. So I'm going to use my stethoscope and listen for the whooshing. So this goes on backwards. So we'll send it through, ready, whoosh. I heard the whoosh, that sounds good. Now I'm going to pull the stomach content out. We can put this on a pH strip, and this will help us know if it's in the right area. If the levels are anywhere from 1 to 4, we know it's good. If it's higher, then it's probably somewhere other than the stomach. So, like I said, those are the three ways: the whoosh, the x-ray, and the pH strips. So now that we know it's in the right place, let's secure it to our patient. So I'm gonna have my husband come over here, and he's gonna be my model. And for videoing purposes, I'm just gonna take this out and put it on his head, not in his head. So if you can just hold that for me. We are going to put this under, and we're gonna clamp it, just like so. Then we can bring this around. Sometimes you can clamp it up like, Natalie did something where you clamp it up right here, but my gloves aren't working right now, so I'm going to, sorry babe, put the tape right there, and then wrap that around like so. And then I would then pin it to his gown, because if his gown pulls it, it will pull right here and it won't pull from his nose. So you'll want it in those three locations. So yeah, once it's connected, that's when we're going to connect to the suctioning. Before I would have started this procedure, I'd want to make sure that the suction machine is working, that I know how to use it, and I do, so that's great. So I'm going to go ahead and attach it to the suction here with my handy dandy straw. We connect it to the machine, make sure that everything's going well. This just stays here for breathing purposes, but perfect, great. I could use skin prep before putting it on, and then adhesive remover when taking it off. So that finishes off our first part of the video.